Welcome. Today, we're delving into a serious and often misunderstood condition, idiopathic pulmonary arterial hypertension, or IPH. We'll explore what it is, what causes it, how it's diagnosed, and the available treatment options. Our goal is to provide a clear and informative overview of this complex disease. The term idiopathic means of unknown cause. Therefore, idiopathic pulmonary arterial hypertension means high blood pressure in the pulmonary arteries, without a clearly identifiable underlying cause. Unlike secondary pulmonary hypertension, which is caused by another condition like lupus, HIV, or chronic lung disease, IPA appears to arise spontaneously. Research suggests genetic predisposition may play a role in some cases, as mutations in genes like BMPR2 have been linked to an increased risk. However, the precise mechanisms that trigger IPH remain a subject of ongoing investigation. In IPH, the small arteries in the lungs, called pulmonary arterioles, undergo progressive remodeling. This involves thickening of the artery walls, narrowing of the vessel lumen, and ultimately, reduced blood flow. The constriction and blockage of these vessels increase resistance in the pulmonary circulation. The heart's right ventricle has to work harder to pump blood through the constricted pulmonary arteries. Over time, this increased workload leads to right ventricular hypertrophy, meaning the muscle thickens. Ultimately, the right ventricle may fail, leading to right-sided heart failure, a life-threatening complication of IPH. IPH is a relatively rare disease. Estimates suggest it affects approximately 2 to 7 people per million worldwide. It's more common in women than in men, typically diagnosed between the ages of 30 and 60, although it can occur at any age. Because IPH is often underdiagnosed, these numbers may underestimate the true prevalence. The diagnosis can often be delayed because the symptoms are nonspecific and can be mistaken for other, more common conditions. The signs and symptoms of IPH can be subtle at first and often develop gradually. Common symptoms include shortness of breath, especially during exertion, fatigue, dizziness, or lightheadedness, chest pain, swelling in the ankles, legs, and abdomen, edema, and a bluish tint to the skin or lips, cyanosis, which indicates low oxygen levels in the blood. As the disease progresses, symptoms become more severe and may occur even at rest. It's crucial to seek medical attention if you experience any of these symptoms, particularly if they are persistent or worsen over time. Diagnosing IPH can be challenging because its symptoms are similar to other cardiopulmonary conditions. The diagnostic process typically involves a combination of tests. A physical examination and detailed medical history are crucial first steps. Non-invasive tests include an echocardiogram, which uses sound waves to create images of the heart and can estimate pulmonary artery pressure, a chest X-ray, which can reveal enlargement of the pulmonary arteries and right ventricle, pulmonary function tests, which assess lung capacity and airflow, and a ventilation perfusion scan, which can identify blood clots in the lungs. The gold standard for diagnosing IPH is a right heart catheterization. This invasive procedure involves inserting a thin tube into a vein in the neck or groin and guiding it into the pulmonary artery. This allows for direct measurement of pulmonary artery pressure and assessment of the heart's function. While we don't classify IPH into different subtypes in the traditional sense, it is part of a larger group of pulmonary hypertension. Within Group 1 of pulmonary hypertension, IPH simply means pulmonary arterial hypertension without a known cause. Understanding this classification helps doctors differentiate IPH from pulmonary hypertension caused by other conditions such as lung disease or heart failure. Unfortunately, there is currently no cure for IPH. However, various treatments can improve symptoms, slow disease progression, and improve quality of life. These treatments target different pathways involved in the disease. Medications include endothelin receptor antagonists, which block the effects of endothelin, a substance that constricts blood vessels, phosphodiesterase 5 inhibitors, which relax blood vessels in the lungs, prostacyclin analogs, which mimic the effects of prostacyclin, a substance that dilates blood vessels and prevents blood clots, and soluble guanylate cyclase stimulators, which relax blood vessels and improve blood flow. In some cases, oxygen therapy may be needed to improve blood oxygen levels. For patients with severe IPH who don't respond to medication, a lung transplant may be considered as a last resort. In addition to medication, lifestyle modifications such as regular exercise, a healthy diet, and avoiding smoking are also important for managing IPH. Because the exact cause of IPH remains unknown, there are no specific preventive measures. However, it's essential to avoid known risk factors for pulmonary hypertension in general, such as smoking, exposure to certain toxins, and using illicit drugs. Maintaining a healthy lifestyle, including regular exercise and a balanced diet, can also help reduce the risk of developing cardiovascular disease, which can contribute to pulmonary hypertension. If you have a family history of pulmonary hypertension, genetic testing may be recommended. The prognosis for IPH varies widely depending on the severity of the disease and the individual's response to treatment. Historically, the survival rate for untreated IPH was poor. However, with advances in diagnosis and treatment, the prognosis has improved significantly in recent years. Early diagnosis and prompt treatment are crucial for improving outcomes. Recent research efforts are focused on identifying new therapeutic targets and developing more effective treatments for IPH. Areas of active investigation include gene therapy, stem cell therapy, and the development of personalized treatment approaches based on individual patient characteristics. Researchers are also working to better understand the underlying mechanisms of IPH in order to develop more targeted and effective therapies.